Building on that vision, it's now my pleasure to introduce someone who has played a key role in growing and sustaining that impact over years. Naga Uncle is someone who has been the driving force behind AID for over 2 decades. Naga Uncle has begun his journey with AID in 2002. Since then, he has played a key role in every level of organization, from local chapter to leadership at national operations. With an MBA from Duke and background in healthcare leadership, he brings both professional expertise and the commitment to grassroots development. Please join me in welcoming someone with whose passion and long-standing commitment continue to shape AID's mission, Naga.
Thank you, Vaishnavi, for the affectionate introduction, Naga Uncle. I'm now popularly known as Naga Mama amongst a lot of AID families. The kids call me as Naga Mama, so here's Vaishnavi continuing. Well, my name is Srinivas Naga Rao Chadaram, so you will see my name when you receive the AID receipts. And affectionately, people know me as Naga and AID. Great. So, as you all have heard the story of AID and how Ravi started, it was really good. When I got introduced to AID first time in the year 2000, that's the when Gujarat earthquake happened. That's the first time I heard about AID. And in 2002, when I moved to Duke University for my research fellowship, is when I actively got engaged in AID, and from then on, there's no turning back. Of course, what drew me to AID was that, as Ravi said, it provided an opportunity to connect with villages in India. And growing up with all in India, we do see so many different things happening, and that kind of influenced my thinking. But when I got to hear about AID, the intro presentation that the graduate students welcome did, and then subsequently when I heard directly from the grassroots leaders from India, it kind of built a permanent bridge for me, and it's now part of my life. So AID is like what Ravi has shown, the way it does help us connect, and the same way I'm hoping some of you will get connected. I know here we have Professor Natarajan and his wife Jayanti, and quite a few other volunteers. And in fact, this is I think the third or fourth trip to Columbus. I have been here before to welcome the new students. So I'm happy to see that the AID Columbus chapter is one of the university chapters that is still thriving, and thanks to Vaishnavi and team that they have carried on the legacy and keeping it going. And I'm hoping more of you who are here today will join forces and make this a much more viable chapter, and there's a lot more to be done. So today what I thought is Ravi shared the vision of what AID was, and I thought I would share a few examples of over the 30 plus years that AID has been functioning and connecting with the grassroots in India. What are some of the key things that we are learning and how we are evolving, and how collectively we are collaborating with our grassroots partners to bring about effective change. So before I go there, I just wanted to check how many people are from Eastern India here, from the eastern part of India. Okay, 1, 2, 3, great. How many are from the northern part of India? 1, 2, 3, 4, awesome. Western part of India? 1, 2, 3, 4, 5, great. So I'll share examples. I know Ravi spoke about the Eureka program and the agriculture program, which is mostly in the southern part. So I thought I will use some examples from these different parts of India. And the first thing I want to share, as was mentioned by Ravi, we do have grassroots partners across India. In fact, you can see all the stars. Those are the places or states where we have currently active programs with project partners, and you will see there is a common theme amongst all of these grassroots work that we are doing. So the first example I want to bring up is about the impact of climate change that is happening, especially in eastern part of India. We are with our learnings, like having worked all these years, I know in the early days, Ravi and team were working in in some of the grassroots movements in Madhya Pradesh and Maharashtra and all the places solving water and electricity crisis. We have partnered. One of the earlier projects that I was involved was in watershed in Gujarat through Mosda Collective in Gujarat. So all those learnings, what has led to the last 6-7 years, Somnath, who is one of our development coordinators, has actually taken focus. This is one of the area where Jharkhand and west of West Bengal and parts of Chhattisgarh are really very drought prone, and a lot of the tribals in these areas are really suffering because women have to spend almost have to walk 5-6 kilometers every day to even get some water. Right? The cattle does not have water, so it has a huge impact. And with climate change, it's even becoming much and more grave. So what they have done, the team has done is they've gone collective to every village and trying to say, okay, what are the problems? What can we do? And they're also listening to the elderly folks who have seen better lives before. They said there used to be a river here, there used to be a stream here. So what's happening? How was the natural water flowing? So the team is actually using modern techniques like geomapping and looking at satellite images and all of that, collecting data, how the water flow is and where. And so they have been closely working with the community, trying to raise awareness. And a lot of women have stepped forward. You can see in the picture there, they have stepped forward to actually build bunds, like wherever the natural flow of rainwater is, how can we build bunds to save this water? So that we save the water flow from being rushed off, because now there are no trees, nothing, so water is running off. How can we store this water to make sure that the water seeps in? So, just to keep short, I know we have only 15 minutes here. The quick thing here is that with the 5-6 years of work, we are now seeing a revive. The Kuil River has been revived. We are seeing streams of water flowing in. Previously, by end of October, after the rainy season, or by November, all this place would become dry. Now, even in February, March, up until the summer starts, they are seeing water, and they are seeing some of these streams. They have built several ponds so that now all the women don't have to walk 5-6 kilometers to get water. So this is again a great collaboration going on with 5 or 6 different grassroots organizations in Jharkhand, West Bengal, and northern parts of Chhattisgarh. This has been really something that we all can feel proud about. Similarly, community health program. Here's another question. Oftentimes we know India. People are going there for medical tourism. There are world-class, top-notch facilities available in India for healthcare. But if you go to a village 30-50 kilometers outside of a big urban area, you would not see any doctors or you would not see any nurses. Even the public health system may have clinics, but there will not be the presence of the nurses or doctors in there. And the realization came that even during COVID, the situation was so bad, a lot of people, a lot of the urban areas were being shut, and people were asked to leave, and they all were forced to go back and migrate back to their villages. And suddenly they realized that there is no healthcare, nothing is there. So AID has been working with a lot of healthcare partners since 1994, 1995, and with the knowledge, what was pointed out was that we can never expect a doctor or a nurse who is trained and qualified to come and really settle with these communities in these villages. So it is better that we actually pick women from the village, especially women who have at least passed 5th grade or 6th grade, and start working with them, training with them. And in fact, one of our volunteers who's gone back, her name is Vasundhara, she is a family medicine, she trained in family medicine, she has gone back, and she is very effectively using simple things like a human model. She would take to the women a human model to the villages and actually sit down with the women, talk to them about the very basic things. Why is malnourishment so important? Why is boiling water, filtering water and drinking is so important? Very basic things. So we are training healthcare workers in every village. There are at least 2 or 3 women being trained. And it's not done in isolation. The whole village sees when we are training these people, so that the trust is built on Okay, now tomorrow if something happens, whether it is a snake bite or a scorpion bite, or there's malnourishment or prenatal or postnatal care, at least these women know what is being done. And then of course they are documenting the malnourishment. Any cases that need further follow-up, our team is following up and linking them up with like-minded doctors who are willing to spend time and give that. So this program is again going on in multiple states like Chhattisgarh, Orissa, Bihar, Madhya Pradesh, and in Rajasthan, Gujarat. So we have a lot of healthcare program going on, collaborating with great partners like Sati Sehat, with Jan Swasthi Sahyog, and our own volunteers building on going there. So this is another program that the last 4-5 years AID is putting in a lot of energy, and we are seeing some significant results. Another program, this is with one of our partners called Janpat in Gujarat. AID has been working with them since the Gujarat earthquake, and one of the programs that I am very deeply involved in, there is a community called Agariyas. These are farmers, salt farmers. Anybody has heard about salt farming or salt making? Or anybody, can you share how much do you pay for your iodized salt that you buy from a store? And I'm looking for some participation here. Anybody remembers how many dollars you paid for the last salt can that you purchased, iodized salt? Roughly about $2.50 or $3. That's the iodized molten salt, right? So in India, if you go buy, say, a Tata Salt packet or something like that, it costs about 400 rupees or so in a grocery store. But can you guess the people who actually, like Gujarat, the Agaria farmers, they produce 70% of India's man-made salt is made there. Any guesses how much that these salt farmers get per kilo of salt that they're producing? Out of the 400 rupees in India, or $2.50 or $2.50 here in the US? Any guesses? 200 rupees? 50? 50?
I hear 40 here.
You hear 40 here? Yeah, even nobody's close. Yeah, half of 40, 20 rupees is what a salt farmer gets in India for the 400 rupees of salt that you're purchasing. So they actually spend, like, the whole salt making process takes about 8 months. They start in the month of October, right after the rainy season, because the little run of Kutch is a marshy land during rainy season, and then it starts drying out, and towards the end of October is when they go and start making the salt, and end of April or beginning of summer in May is when they are actually harvesting the salt. So in these 8 months, a family, Agaria family of like, say, the wife and husband and 2 grown-up kids, is able to produce, and the total produce that they may get out of the tons of salt that they make is totally is about 5 lakhs. But their cost of production, it goes anywhere between 4 to 5 lakhs, depending on how much the salt trader, and oftentimes they are taking money, as Ravi mentioned, right? Oftentimes the middlemen, the money lenders. And so we figured out, like Janpat figured out, like talking to like almost 3,000 families, oftentimes they are not really making any money because the salt trader is actually driving the prices down for them, and also by giving exorbitant loans upfront, even if anything goes wrong, they won't care, they will just take the salt away, and that's all. So the team figured out that with the biggest cost was the diesel, which was used for pumping out water. So we switched them to solar pumps. Like they first tested out the model with 5 farmers, it worked. 50 farmers, it worked. That with implementing the solar panel for pumping water, they were able to save all this diesel costs of 2.5 lakhs to 3 lakhs. That was the real saving that they were seeing. So what we did, like Janpat took that data, and because these were the partners who were the technical support from them, they presented this to the government of Gujarat and the central government, saying, folks, this is really working well, and we should be able to push it to. So after about 3 years of advocacy, they did get the government to agree, but the government is not going to give the money or how. So they said, okay, we will give a subsidized loan package. It has to come through the banks, but we also need collaterals. from these farmers. I mean, these are Agaria families, these are tribal families that live on the periphery. Where will they get the collateral? So 8 chapters here put together a 1 crore rupee fund that we were able to support, like on an annual basis, we were supporting 50 to 80 farmers. We would give the collateral guarantee, and actually the salt farmers were able to repay the loans in 2 years and build on. So we were able to push about 300 plus farmers like through 8 collateral. But now that the government has seen the efficacy of this program, they went ahead and first agreed to fund about 1500 farmers, and then they took it to 3000 farmers. So the program actually has stopped like after 3 years, but about 3000 salt farming the farmers across the little run of Kutch now have solar panels, and partly because Janpad, Vikas and AID came together and got this going. And all of these Agaria families are now able to save all the diesel costs. It's helping them. To the point that about 2 weeks back there was a huge cyclone, and a lot of these, about 1200 farmers lost all the solar panels that they got really. But they are not asking us for any emergency support. They in fact said, we don't want any support, we are going to demand from the government. When the government gives subsidies to various farmers, why not salt farmers? And so they have actually taken this up as an advocacy effort and trying to get the government to respond, because they saw that collectively we got the government to actually put in a subsidized program. So now, based on those learnings, Janpad and Vikas are actually taking this to the regular farmers, right? I mean, there also there's a lot of water irrigation. India needs a lot of water pumping to be done, especially for water intensive crops. And so there again, the government says, oh, we'll do a 10 HP and we'll fund. But what Janpad and Vikas are documenting is that with a 1 HP or 2 HP pump and using drip irrigation, you can effectively do agriculture and increase the profits and push down the cost. Not only that, also conserve water, because that's the critical part in India now. If anybody has seen the water table, it's only going down. And with all the irrigation intensive agriculture, it's not really feasible to continue. So this program has now been expanded to about 15 farmers are being piloted. It's going to be expanded to another 25. And so we are hoping that this data can be collected and move forward. So with that, I mean, these are some of the initiatives that AID has been working with our partners and with support from volunteers here. As I said, that 1 crore fund has helped to get about 3,000 farmers with a model program and get 3,000 farmers. And now we are using that to support drip irrigation, which is again taking people forward on the farming sector as well. So these are some great examples which I wanted to share. Of course, these are some of the pictures. While the Agaria, the farmers are in the desert, where do the kids go for their learning? They have been focused on setting up learning centers. These are some of the buses, again, a very innovative way. They got the Gujarat State Transport, like all the discarded buses which are not mobile. They actually got those buses as shelters and transformed them into ranchalas, into classes where the kids are, instead of sitting in tents outside in the hot summer or in the hot sun in the desert, they are actually sitting in buses like this where they are studying. So yeah, I guess Vaishnavi is here to say our time is up. So yeah, no, that's fine. And I know Ravi already spoke about Kishan Mitra. So finally, I think one of the initiatives that Vaishnavi really loves is the bicycles for girls, and truly it is a game changer. You can see in this image, here's a young kid, and she was learning from one of the tribal guys in the Tamil Nadu villages. He was the only one who had passed, I think, 5th or 6th grade at that time. Now the girl has grown up. Without bicycle, she is able to complete her schooling, and now she signed up for a nursing school program. But like with the 1,000 plus girls that we have funded over the last 2 years for cycles, it's really creating a difference. So here's where, and again, one of the things that Vaishnavi wanted me to focus is how can supporters, how can volunteers really become part of this change, is that you can volunteer, you can learn from how initiatives in India are making a difference. and definitely please step up and join the 8 Columbus team here in keeping the flame of aid alive and your connection with grassroots India alive. And definitely your support, especially the professors and all the community members here, your donations will really make a huge difference for the 8 Columbus team and 8 to carry on some of this work. So please step up. And likewise, I would say, as youngsters, I know we all may have different ideas and different things that are going on in our lives in addition to getting education and also figuring out how do we build our careers. But there are enough learnings. You learn to become good leaders. You learn to become good presenters. Definitely there is a career development also involved in the volunteer activity. And especially for students, I know these days network building is a big thing. Aid does help. Like some of us, like the volunteers, we always look out for other volunteers and help them in their careers, help them connect. I always get my next jobs whenever I need. I do reach out to my aid network and they do help out. So these are some of the things that I would like to share with the students here. Please do join aid and support aid. And very simple things, like I know when Ravi and all tried, like maybe you are going for 7 days, you are having a coffee in Starbucks, like $2 or $3. Even if you give up 2 coffees a week, that will help Vaishnavi support one more girl get a bicycle. That changes, that brings about a huge change. So with that, Vaishnavi, sorry if I extended my time.